Welcome back. We're picking up right where we left off in our deep dive into the neural circuits of pathological anxiety, all based on that landmark 2024 review in Nature Reviews Neuroscience.
So, in part one, we really focused on the brain's threat response circuits. But, that's not the whole story, not by a long shot. To truly get a handle on pathological anxiety, we have to look beyond just fear. We need to explore what's happening in three other critical areas: what happens when our sense of reward gets blunted, how our cognitive control starts to fail, and why our social world can become so difficult to navigate.
All right, so let's jump right in, starting with what's called the positive valence system. This is the circuitry that's all about how our brain responds to good things, to motivation, to rewarding experiences, and how it learns from positive outcomes.
Now, this system, centered on areas like the ventral striatum and the ventral medial prefrontal cortex, is absolutely fundamental for learning. And here's something this review really hammers home. We usually link problems here with depression, right? But it turns out it's also a critical driver of the avoidance and withdrawal that we so often see in anxiety disorders. So the first key result here is a blunted reward response, a state you might know as anhedonia. And the fMRI evidence you're seeing here is just striking. Compared to healthy controls, people with social anxiety disorder and generalized anxiety disorders show significantly less activity in their ventral striatum, that's the brain's main reward hub, when they're anticipating a reward. And you can see how that plays out clinically, right? It contributes to this emotional flattening and this powerful pathological urge to withdraw. And this second finding, honestly, this might be even more crucial for understanding why anxiety is so persistent. It isn't just that good things feel less good, the brain's whole ability to learn from them is impaired. You see this broken learning cycle here? Normally, when something turns out better than you expected, your brain gets a little reward prediction error signal that helps it update its map of the world. But in GAD, that link is disrupted. The brain literally fails to learn that a situation is safe, even after a positive outcome. It's effectively trapped in a state of anxious waiting. Okay, so how does this problem with reward connect to everything else? Well, that brings us to our next two domains, the cognitive and the social systems. This is where we get into how anxiety impacts the brain's ability to regulate its own emotions, manage attention, and interpret the world around us. You can think of the brain's cognitive system as its executive control center, or maybe a better analogy is the brake pedal. You have these key regions, especially the dorsal lateral prefrontal cortex, the DLPFC. And their job is to apply that top-down regulation, to pump the brakes on all the emotional interference coming from those threat circuits we talked about in part one. It's what helps you stay on task even when you're feeling distressed. But in pathological anxiety, this system becomes highly inefficient. The research shows a really distinct pattern. At first, the DLPFC goes into overdrive. It hyperactivates, working way too hard to suppress all that emotional noise. But that's just not sustainable. You can see the consequence in the data here. Eventually, that hyperactivation flips to hypoactivation. The system essentially burns out, depleting its resources. And that failure of control is what opens the floodgates for the persistent worry and intrusive thoughts that define disorders like GAD. Beyond just internal cognitive control, pathological anxiety also has a profound impact on our social brain. We're talking about this whole intricate network of regions that allows us to navigate the incredibly complex social world, everything from recognizing faces to inferring what other people are thinking. And when this system malfunctions, you get this kind of trifecta of social challenges. First, a hypersensitivity to social rejection, where being excluded literally activates the brain's pain networks more intensely. Second, a perceptual bias, where circuits misread neutral facial expressions as negative or threatening. And third, a breakdown in communication, especially in social anxiety disorder, where the lines between perception circuits and regulation circuits just go down. So we have these individual circuit failures, but how do they all combine with stress to create a durable pathological state of anxiety that's so hard to shake? Well, the answer lies in stress-induced neuroplasticity. And this is so important. We're not just talking about a chemical imbalance. Chronic stress physically reshapes our neurons. You can see the physical change right here. In the prefrontal control regions, the little branches on the neurons actually shrink. They atrophy, which leads to a loss of top-down control. And at the exact same time, in threat detection regions like the amygdala, those branches grow more complex, a process called arborization, which ratchets up threat reactivity. The brain is literally, physically hardwiring itself for anxiety. Now, this kind of deep, circuit-level understanding is so much more than just academic. It is paving the way for a revolution in how we diagnose and treat anxiety disorders.
So here's the crucial point. This is a massive paradigm shift. For decades, diagnosis has been based on symptom checklists like the DSM-5, but that approach lumps patients together who might look similar on the surface but have very different things going on in their brains. The new approach is to identify biotypes based on which specific neural circuits are dysfunctional in a particular individual.
And this is where the real-world benefit just becomes crystal clear. By identifying a patient's biotype, we can start to use highly targeted precision therapeutics. If the main problem is a reward deficit, maybe a dopamine agonist could help. For inefficient cognitive control, neuromodulation, like TMS, could be used to boost the function of that prefrontal cortex. For connectivity issues, specific types of therapy like CBT can actually help rewire those connections. To sum it all up, if there's one take-home message from all this research, it has to be this. Pathological anxiety is not just an overactive fear circuit. It is a complex, multi-system dysregulation that affects our positive valence systems, our cognitive control circuits, and our social processing networks. And understanding these distinct dysfunctions, well, that's the key to unlocking the future of mental health care. This new, incredibly precise understanding of the brain doesn't just offer better treatments. It leaves us with a critical and, I think, very hopeful question for the future. As we get this good at mapping individual brain circuits, can we move beyond just treatment and actually start to prevent mental health disorders before they even emerge? Thank you for joining this explainer.